Good morning. I'm Pat Croce, and this is the American Cancer Society's Healed Community Gathering. Healed, health and energy through active living every day. And it is our intention for the next hour to inspire you, motivate you, educate you, and encourage you to live healthier lives, mind, body, spirit, in the present moment, and to suffer less. And I bring you great guests every week, and this week is no different. This is Breast Cancer Awareness Month, October. Last week we had Brandy Plotnick and Dr. Dambro, who were truly wonderful. Well, you're going to enjoy today as well. I'd first like to thank our presenting sponsor, 6ABC, who provides us with the ability to share this hour-long show with all of its viewers on 6abc.com and all of their various platforms. I'd like to thank our leadership partners who've helped, there's about 30 of them, who've helped me raise the $2 million so that the research in Atlanta at ACS headquarters is underway. And for each and every one of you who've gone to acshealed.com and gave anywhere between $5 and $5,000, and in return, we give you this way cool bracelet with that one green bead that simulates we're all in this together. It also is healing, harmony, and nature. Thank you once again. We start the show, the gathering, with a moment of stillness. And I do that by ringing this little Tibetan bell. And all I ask you to do is place your attention lovingly on the sound of the bell. You can close your eyes if you like. There, that's our doorbell to this sacred space, the ACS Healed Community Gathering. We leave all of our troubles at the door. We just rang the doorbell. You're all entering this space. We're all in this together, this one aware, imperturbable presence together. And it gives me great pleasure to bring in our guest every week. This is our 25th community gathering. How about that? And we've enjoyed every one of them. And I guarantee you will enjoy this one as well, because I've met our guest already in the green room. And we're going to share with you now. Our first guest is Dr. Yoon-Flannery. And Dr. Yoon-Flannery is the co-director of the Janet Knowles Breast Cancer Center at MD Anderson Center at Cooper in Camden, New Jersey. She oversees the Cooper's breast cancer care program, and she completed a breast surgical oncology fellowship at the University of Pennsylvania, and also something called a certification in the hidden scar breast cancer surgery. And we'll talk all about that. And first, let's meet Dr. Yoon-Flannery.
Hi, Pat. Thank you for having me.
Oh, it's wonderful. And I love your sweater and the flowers behind it. The colors look great.
Oh, thank you. I tried.
You're bringing some pink to the program.
I figured as a breast surgeon, I have to be really familiar with the color pink, particularly in the month of October. So I do try.
Well, you're trying very well. So give me that. As a physician and a breast cancer surgeon specialist, lead us on this path. What brought you here?
That's a really interesting question. I get asked that question a lot when I, obviously see patients. I'm very involved in resident physician education, medical students as well. I actually never knew that I was going to be a breast surgeon. I wasn't even sure I was going to be a surgeon. I remember coming into medical school. I was already married. I was fairly newly married, and remember telling everybody that I was either going to be a pediatrician or an emergency room doctor. But I had a chance to come into the operating room as a first-year med student, where the surgeon let me make an incision on the patient. So I still remember that moment where I held the scalpel for the first time. And, to say that was an aha moment was pretty incredible. I knew that instant that I was going to be a surgeon.
Wow, that's magical.
Yeah,
I love that. I love that you remembered that specific that aha moment. I call it a glimpse
Yeah.
of pure awareness.
Yeah. The decision to become a breast surgeon came a little bit later. I was already in my surgical residency training, and I was on call. We did a night float system where you're taking call every night for a week long. And so I was the night resident, and we had a patient who came through who was hospitalized from a fungating, very advanced breast cancer. And she was there. And I remember talking to her. They consulted me as a general surgeon, asking if there was anything surgical for us to do because she was so sick. She was still able to carry on a conversation. And, I was a young resident at the time. So you maybe are too brave, or maybe I shouldn't have asked these questions, but somehow I asked this woman a question. How could you let this get so far before you came to the hospital? She tells me at that time that she was also a retired nurse. And I said, how? You should have known better. How could you do this? I'm sure I said it hopefully a little bit better than that, but I did ask her. And what she told me really broke my heart that night. She told me that she had only one daughter, and that she had been estranged from that daughter for many years, maybe even a decade. And when she first noticed the lump and it started to grow, she realized that, especially with her nursing background, that this was not good, but that she didn't want the first phone call to her estranged daughter to be about a cancer diagnosis.
Oh.
So she ignored it instead. She didn't want that. And, it just really broke my heart because for some unknown reason, even somebody with a medical background got to a point where she thought, let me address this early on. I would rather ignore it because I don't want the bad news, fully knowing that this was going to be the bad news, and to share that with her family. And it really changed me. I cried with her that night, and I swore to myself that I would do everything I could so that the patients that I treat would not get to that stage as much as I could help it. And so I decided to be a breast surgeon then.
So, Dr. Yoon-Flannery, do you remember that woman's name? Just the first name.
I don't know if I should share it.
Okay. Well, all I was going to say is whatever her first name is, our teachers come in various forms.
Yes.
And she just happened to be Grace manifesting as a teacher for you. Therefore, she gave us you. She may not have had the breast surgery as early as it should have been detected, but because she waited, she got you turned on to breast cancer surgery. And therefore, now we have you as one of our advocates and role models in helping detection and screening. And give me what is this hidden scar breast cancer surgery? It sounds exotic, and it sounds like something, who wouldn't want it?
So we actually, so it's a certification that you go through, but we also say those of us who are fellowship trained, really inherently get trained for what we call oncoplastic or cosmetically appeasing type of breast cancer surgery. Not too long ago, every breast cancer patient would have to end up with what's called the modified radical or even radical mastectomy, where you're getting your entire breast removed, all of your lymph nodes removed, all of the skin, and even the chest wall muscle, and no thoughts whatsoever as to the cosmetic result, and certainly no consideration to breast reconstruction. We've made great strides in the past many decades. Hidden scar comes mostly with breast conserving surgery or lumpectomy, where you're not necessarily doing the entire breast removal, which is combined with what's called the breast reconstruction, where the plastic surgeon rebuilds your breast. When I do hidden scar, I try to hide the scar when I make the incision for lumpectomy. So if the lesion is a little bit close to the nipple areolar complex, I'll hide the incision around the nipple areolar complex. If the lesion is sort of on the near the underside of the breast, I'll hide it in what we call an inframammary fold. And so, when the patient heals up from the surgery, even actually immediately post-op, it's usually well hidden under your breast. And the whole purpose of this is perhaps that when you are, done with your treatment and, you've moved past that immediate active treatment phase, you don't have an ugly scar to remind you of what you had to go through. So we put a lot of thought into it, and a lot of the fellowship trained breast surgeons really do get trained in this so that we don't necessarily not focus on the cosmetic part of it.
Are you artistic by nature?
I really never thought I was. My mom was trained as an artist, and I always sort of, you always fight your mother growing up, and I hope my mom's not watching this. But so I said, I'm not artistic. I'm not going to do it. But I have noticed in the recent years I must be, because all the hobbies that I've picked up along the way that I do in my off time, whatever off time I would have, either not working or dealing with my 4 crazy kids, it's something to do with arts. I've recently picked up dollhouse rehabbing, where I'm rebuilding dollhouse furniture and painting houses that I pick up from various places. And a lot of the things I do really have artistic ways for me to express myself. So I must be.
So what other ways are there? And before we go on relative to the patient treatment programs that you use, tell us more about your hobbies, because I love this. It's mindfulness in motion. Instead of meditation on a cushion, you are meditating and getting totally involved in what is passionate with you. So share with us, in addition to dollhouse furniture rehabilitation, what else do you do?
I think, as with everybody during the last year and a half with COVID, we have fortunately or unfortunately had some time to reflect, right? Prior to COVID, I will tell you, I was out having some kind of evening meetings, whether it was a dinner meeting or in the office or outside, at least 2 to 3 times a night. And then once COVID hit, everything shut down and I was home, and I was cooking meals. I mean, sometimes like 2 meals a day for my kids and my husband almost every day. And I really realized my love for cooking during COVID. So just looking up random recipes. I'm all about efficiency, so I don't do crazy things where you're dealing with 30, recipe ingredients and it takes 3 days for it. I try to be efficient about it. I like to experiment with a lot of spices that I already have. I won't buy things that I don't already have. I won't buy things that I can't pronounce, and I'll just sort of play around with recipes. And so I've really learned to enjoy cooking over the past year and a half.
So there is a silver lining to COVID for many people if they've been curious enough and open enough and available enough to look at something new. So give us, what is one of your favorite recipes that is new that you enjoy most making?
I've actually really enjoyed baking. I learned how to bake sourdough, which it takes patience. You have to grow the starter and you have to feed it every day with a little bit of flour, and you have to keep it at certain temperature. And then when it's the day that you have to bake it, there's a lot of folding that gets involved. It's like an all-day process. My husband, sometimes when I was feeding this starter, my husband said, you didn't feed your kids today, but you're going to feed that starter. Because I would say, oh my gosh, I forgot to feed it. I need that flour and put it in. And it takes, more than a few days to really dedicate yourself. And if the starter is wrong, the bread doesn't come out right. But once you get it right and you fold it the right way and you let it cook, it's just that crunchiness on the outside, and there's just nothing like it, the smell. And I've really enjoyed it. I've baked before where I was making birthday cakes and whatnot, but never sourdough baking. And I've realized I do have patience that I didn't realize that I had before.
So not only patience, but when you're doing something, and this is for all of our viewers. Now, we might have got off topic a little, but we haven't, because this is about mind, body, spirit. That's what Healed's all about. And you're talking about the mind right now, because when you're involved in a passionate hobby, whether it's the dollhouse rehab or it's the baking, is there any effort or unease while you're doing that?
Absolutely. Oh my gosh, you're like, it's almost cliche to say it, but it gives you peace. You know, when I'm painting or rehabbing the furniture, you know, my daughter's talking to me. Last night, we were up till almost 11 o'clock doing this together. She's telling me about her day, and I'm picking out the paint sample that I picked up and trying out different colors. And it's almost like repetitive motion to after a certain amount of time where I'm just painting. And it gives you just this moment of clarity in the middle of the night, gives you time to connect with your daughter. And I think that it almost just wakes me up for the next day, you know, and I really appreciate an opportunity like that to kind of step away and focus on myself and my family.
Dr. Yoon-Flannery, that is truly beautiful. And if nothing else comes across today, I want people to see when you invest your being in the doing, it's so fulfilling. The time is just irrelevant, and it's real, true happiness. That is meditation in motion. That is really the essence of meditation. Now, I'm going to bring you back into the training room, into the treatment room.
Yeah.
What is your personal approach with your patients suffering from breast cancer in their most difficult time of their life? How do you deal with them?
You know, it's a very tough time. It's almost the worst time in somebody's life to be told that you have cancer, that you have breast cancer, and that you have to see a surgeon. And almost always when I see patients, they're nervous. They've already had a couple anxiety attacks. They've Googled all the wrong things, all the terrible things that go wrong with cancer treatment, and they're scared. And you know, I go through all of the ins and outs, the technicality, the research data that I need to be able to tell the patients. But I hold their hand and I said, listen, whatever, I know you don't want to be here, but I'm happy to meet you today. I'm going to walk you through this. And I'm promising you that you will come up with something that I'm going to do for you, and we will get to the other side. And next year, you're going to come back and you're going to tell me about your family. Your husband's going to tell me about how you have been, and we're going to get caught up. And I promise you we'll be on the other side. And patients sort of take a deep breath at that time. That I think that, you know, when a surgeon tells you whatever this thing is, I'm going to take care of it, gives you that moment, it calms you down, you take a deep breath together, and we conquer it together. And it's a scary moment. But I am really fortunate to be able to walk through patients and pull them to the other side, you know, for our patients.
That must be scary, because you're right. They go on the internet and they find erroneous information, and they don't know what they don't know. And some of the things they do know, they shouldn't know. And so when they come to you, at least you are the voice of reason and intelligence. And what is the most frequent question they ask you?
Am I going to need chemotherapy? And actually, when I see patients, I bring up the path report. I go through, I draw pictures for them. I have something called the checklist where I tell people, you know, fortunately, we've been able to at least have one partner or significant other being brought in. You know, at the height of COVID, we couldn't have patients bring in anybody. And the patient's family members will come in usually ready to take notes, sometimes patients themselves. I tell them, you know what? You can take as much notes as you want. I'm going to take notes for you. I have this checklist. I'm going to write down, and you'll have all my chicken scratch notes as we're going through. I want you to listen to me. This checklist will tell you what your next steps are, and it'll jog your memory once you get home. But use me as sort of just paying attention and trying to absorb as much as you can, because whatever I tell you today will go in one ear and possibly out the other. And so they have something concrete to take home with them. And then, I walk them through all of different options so that I can, basically come up with a solution that makes sense for them. My job, I always tell them, is I'm here to tell you what the data is, but I'm also, no breast cancer is a cookie cutter. We have to figure this out. That's why we say it's individualized, and we make the decision together for what makes sense for you.
And as a surgeon and someone who sees specifically breast cancer, how vital, please share with our audience how vital it is for early detection, for screening.
Oh, geez. Sometimes I see patients where I tell them, I try not to panic the patients, right? My job is to calm patients. Sometimes I really rarely, but those patients who are locally advanced where, it's a little bit further and we have to do something, I tell them, I have to do this. I'm going to call the medical oncologist. I already have an appointment lined up for you. We have to worry about getting the poor place to start chemotherapy. It certainly can be scary. For those people that's already happened, I don't tell them we should have detected that sooner. It's already, I tell them we only move forward. We don't go backwards. Sometimes patients will say, did my last mammogram miss it? Or did my so-and-so miss it? I went to see somebody 3 months ago. Did they miss it? And I always tell people, we only move forward. We don't look backwards. But I do tell people, once we've gone to the other side, tell your friends. I just told one person today, tell your friends to get the mammogram so that they can get the detection, early detection, and they somehow don't need to worry about getting chemo up front. And it's a very honest conversation I have with the patients without potentially panicking them at the beginning stage of their treatment.
So you're saying, Dr. Yoon-Flannery, that with early screening, with mammograms and early detection, there's less chance of it expanding and requiring chemotherapy prior to surgery?
Absolutely. And there are other modalities. I don't want to get too deep into this, but the more advanced the disease, the more likelihood that surgery may not be the option. The goal always with cancer is definitive excision, whether that's a lumpectomy or mastectomy. A surgeon wants to be involved and ultimately get rid of the cancer. And then other things like chemotherapy, radiation, and other forms of treatment may follow. Even in early breast cancer, chemo may have a role. Radiation certainly may have a role, particularly if you're dealing with breast conserving surgery. But the goal is always try to get the resection done so that the cancer is out. We never want to be in a situation where it's gone too far. It's gone beyond the breast, beyond the lymph nodes, and somewhere else in the breast, outside the breast in the body, where surgery is not the main course of your treatment.
So before I ask you to sit on the bench, so we bring on our next guest, what is one item, secret, that you want to share right now with the world?
That early detection is key, and that mammogram is so important. And mammogram does not hurt. Okay, a lot of people get worried about it and they've had bad experiences, and it's not necessary or it hurts too much. But there are different techniques that we can use to make it more palatable, and it's worth it because we find so many early stage breast cancers where we are able to do this early on and move forward. And so early detection is key, and annual mammogram is absolutely important.
You just threw in the preface, annual mammogram is vital. Dr. Kayhun-Flannery, I'm going to bring you back, but just take a little break. You've been fabulous. Thank you. Thank you for all of your sharing.
Thanks for having me, Pat.
Our next guest is Tarralyn Jones. And Tarralyn is a 2-time breast cancer survivor who also had a couple of tumors metastasized to her brain. She's the National Events Coordinator for the Pro Football Players Mothers Association. And she's the author of Living a Masked Life. Tarralyn, are you there?
I am. Thank you for having me.
Thank you for joining us. And where are you right now?
I reside in Oviedo, east side of Orlando, near the UCF area.
Oh, I know UCF well. Okay, okay. And so before we get into everything you're into, but this Pro Football Players Mothers Association, why this? Like, why the Pro Football Players? As a director, like National Events Coordinator, what is it?
Well, the correct name is Professional Football Players Mothers Association. And what it is a network of mothers for active and retired players. And it's a support system for the moms so that we can learn the business of football.
And so how is the business of football related to you?
I have a son that plays as well.
Where?
He plays for the Chicago Bears.
And his name?
It's Tarryn Jones.
Tarryn Jones. And
Number
what position?
57, linebacker.
Linebacker, 57. And you had also another son who played, correct?
No, only one son.
Oh, okay.
He's my youngest. My husband played. That's probably what he played with the Raiders.
Oh, wow. But I bet, did they have the Professional Mothers Association then? When he
Not
played?
at that time, no.
So what does the association do with the mothers?
The mothers, we it's a network of the moms. We have a mission to serve, support, and educate and strengthen our communities in which we live by charitable giving. So we do a lot of great things with education initiatives within the organization. So it's a very good organization for the moms to be educated in the business of football.
And you were talking offline that you said now the NBA has contacted you?
Well, it's a collaborative effort. Yes, so that they have their own organization as well, their own platform. So similar to ours, but it's just a collaboration.
And give us now, I want to switch from your daily activities to this. When were you first diagnosed first time and then the second time with breast cancer? And you again wearing pink there. It's a perfect color for this month.
It is. I was first diagnosed in 2002. This was something that was totally unexpected. I had my scheduled mammogram. And from that point, I found out that by early detection, that I was a stage 4.
Wow.
Stage 4. So early detection is very key. Mind you, I want to reflect that it's very important to put yourself first. In my case, during that time, I was very busy as a mom, young mom, working nonstop, putting everything before me. I had scheduled actually 2 appointments before that particular last appointment. I canceled twice. And on that 3rd appointment, I went and had my mammogram done.
And how long was the delta there, the difference between when it was going to be done the first time until you finally went and saw the doctor?
It was a tad bit over a year.
Oh,
actually. Yeah. And I was and found out that I was a stage 4.
And what was the treatment plan?
The treatment had 8 aggressive chemotherapy. And it was very aggressive. Got through that. And then after 2002, I had a reoccurrence in 2008. And the treatment plan with that was the radiation. In 2014, metastasized to my brain. I had 2 tumors removed from my brain in 2014.
With surgery?
With surgery.
Wow. Any side effects?
From the surgery?
Yes.
They thought that I would have, and they told me that I would have, but I did not have.
Beautiful.
Thank God.
Beautiful. Yes. Yes, that's wonderful.
Because the storyline that I tell everybody is, it's your mindset. Number 1, prayer, have a spiritual relationship with the Lord, and it's the mindset, meaning that when I look back on the diagnoses and the things that the health challenges that I went through, I really never bought into it. I knew that it had happened and was happening, going through the treatments, but I never bought into the fact that, if it makes sense, that I was, the side effects, because I really believe that if you start buying into different things, then you either decline or you just get through it. Because I like to say this little slogan: life is like a roller coaster. You can scream every time there's a bump, or you can throw your hands up and enjoy the ride. So some people say, well, how can you enjoy the ride? You can enjoy the ride by following the directives of your physicians. Okay, I have to do this, I have to do that. Just go through the plan and a positive mindset, and the outcome will be great.
Grace. I love that. The outcome will be grace.
Mm-hmm.
So when did grace strike you to realize that you've been sharing your life with everyone else, including your family, and you decided now to become a self-care diva, in your words?
Self-care diva. Self-care, people look at it, diva can be defined very well. You can be a diva in a bad way, or you can be a diva in a good way. In my case, diva is putting yourself first. When you put yourself first, you can help everybody else. Meaning that if you don't feel good today, get up and go put some makeup on. Go take a walk. Put on a nice shirt, a dress. Go to lunch. Just put yourself first. It puts you in that mindset, get you away from whatever's going on around you, so you can gravitate to yourself. And believe me, it works, because it works for me, and I know it worked for you.
Oh, I don't doubt that. I'm all about when you have that positive attitude, it elevates your high vibrational frequency, and that resonates out.
And you know what? It defines competitiveness. I look back on the fact that I tell everybody, you need to dissect yourself, if that makes sense. Go back and find out who I'm 55 years old, and I'm just now, after all these years, learning who I am.
Oh,
yeah, because some things you don't know. I mean, growing up, you kind of bypass things, because I played basketball in high school and college, and so in my mindset, I'm competitive. So with my mind going through all these healthcare channels, I'm competitive. Hey, I'm gonna fight you. You may try to drive, because I was a point guard and a wing guard. So of course, so basically, okay, you try to defend me, but I'm going around you. I'm getting to that basket. I'm gonna make that ball. I'm going inside that basket. So it's a competitiveness that is internal. So I tell everybody, hey, be competitive. Have that mindset. Don't let anything beat you out. Despite what you're going through, you may not feel well. You may feel all oppositions are coming against you. But hey, get that mindset. It's all about the mind.
So, Tarralyn, it is all about the mind. You're right, because we don't have to believe those negative thoughts. They're not our thoughts. They're not
our thoughts.
They're not true.
Mm-hmm.
They're no different than a black cloud in a blue sky. They can just pass on. But
Right.
I have to ask you, at 55, and now knowing a little bit more about yourself, how has that changed you?
It changed me a lot, because as you mentioned, I wrote a book, Living a Mass Life. It took me about 10 years to come up with this, because it involved a lot of personal things and experiences that I have gone through. I found out when I wrote the book and I got these messages, people say, hey, I read your book and I'm wearing 4 or 5 masks. Because a lot of things that you go through, you hide behind that mask. They have you muzzled, they have you in bondage, because some things you don't want to talk about, some things subconsciously that you're holding on to, unforgiveness. And believe me, stress kills. People don't believe that. Stress contributes to a lot of things, a lot of healthcare issues. And I found that with living a mass life, it has given me a form of release. I'm living my authentic truth.
Beautiful. You sound like Oprah. Yes. Yes. Have you been with Oprah on your book?
No, I have not.
So your authentic truth, describe that to us.
My authentic truth is loving me for who I am and what I am and what I represent.
And what do you represent?
Living my best life. Live, laugh, and love.
There you go. Now we're hearing it. Yes. Live, laugh, and love.
Live, laugh, and love.
And can everyone who's watching right now follow that formula for life?
Yes, they can.
Why
I
don't
recommend.
they?
I recommend you to live, laugh, and love every day.
And why don't they, Tarralyn?
Why people don't?
Yes.
Because they allow the outside world to get in, meaning that they make comparisons to others. Stop making comparisons to others. Learn to be you. Be compassionate to others. What you have, be grateful for what you have.
And this is coming from someone who's had double doses of breast cancer and brain tumors, correct?
That is correct.
Do you have any regrets, or do you feel this has been a learning experience?
This has been a learning experience. I take experiences in grace because I can take my experience and share with others to describe things not to do and what to do, and to contribute to helping you live your best life.
And is your book available on Amazon?
My book is available on Amazon. Also, you can go to TarralynJones.com, where you can also get an autographed copy of the book as well as a Self-Care Diva products.
I love that. I love the Self-Care Diva is what a great mantra. Give us, I want to know the moment you decided to put pen to paper to write the book. Like what was the change in you? Before that, it had to be a no, you can't do this, that won't work. There had to be some sort of metamorphosis to a positive yes inside you. What was that?
In 2008, that was the year that I said, this got to be done. I got to write the book.
And was that after the second diagnosis?
Yes, the second diagnosis, it was a yes. Because a lot of things contributed. When I started dissecting and peeling back some things, I saw some contributing factors to leading to those particular challenges that I was having. And that was putting everything before me and not focusing on me. And that came from not just healthcare challenges, but life in itself. Sometimes life can swallow you if you allow it. Because think about it, when you get up in the morning at 7 a.m., right? Before you know it, it's already 9 o'clock at night. That's how fast the day go. So that tells you how fast life passed you. So I tell everybody to cultivate your life, live your life. I mean, your moments are going so fast. Just live, laugh, love.
And they don't realize, Tarralyn, that to live life, live, laugh, and love means now.
Now.
That's what people don't realize. They realize, oh, I'll get to it.
That's
and
right.
that may have been you up till 2008. Then you realized that the now was sacred.
The now is sacred. That's correct.
And from the 2002, the 2008, the 2014, you become an advocate.
Yes, I have.
American Cancer Society for breast cancer and brain cancer.
Yeah.
What exactly are you doing on this route?
Well, I developed what we call a Self-Care Diva chat. And we did it on, the first promo was on September the 9th. And we bring on guests that talk about self-care on all platforms. And you'll be surprised who these people are, because from the outside in, you think they have the world. But when they start dissecting and telling you their personal experiences to getting them to self-care, it's going to help so many people. And I'm so excited about it.
And when you talk about self, you're talking about self with a capital S, the God self in us, not this small egoic separate self where, me against you. It's really that what some people might say, the super soul or the oneness that's all of us. See, I love that. People don't realize back in the ancients, back on the Temple of Apollo 3,000 years ago, 2 words were inscribed on it, Tarralyn: know thyself.
Right.
That's exactly what you're doing 3,000 years later. You're telling people not only know thyself, take care of yourself.
Take care of yourself. And I had to learn too, you never think about the exercise, the food choices, and being an advocate for yourself, meaning that, okay, you have a physician, but building that relationship with your physician is very key.
Oh.
I am so, I have so honored to have physicians that I built relationship with, that they care about you. You can talk about things. They educate you on the process. It's so important that you're comfortable with your physicians, and not only that, be an advocate for yourself as well.
Well, when you're an advocate for yourself, your physicians will be an advocate for you, right?
Alongside. Yes, that's correct.
When they realize that you truly care about yourself and you're curious about living your best life, as you say, to live, love, and laugh,
Mm-hmm.
I mean, the world then tends to gravitate to you to help you.
Right.
I think I love this. So living a masked life. What would you say is the greatest takeaway from that book? And then I'm going to bring Dr. Yoon-Flannery back on that and double team you too.
Sure. The greatest is being able to remove the mask, taking the necessary steps to remove the mask so you can live your life, living in your truth.
And how difficult is it to remove that mask? It must be very difficult.
Well, you know what? It may be difficult for others because they've been complacent as far as wearing the mask, because they're comfortable behind the mask.
Mm.
They're comfortable because they're still hiding. They're not ready to release the reason why they're hiding. Mm-hmm. But the book actually walks you through how to remove the mask and live your life authentically. So I'm just very excited about it because of the responses that I've gotten from it. Some of them were very surprising, others was not, because they said that it really ministered to them, and now they're living their best life. So when you hear those type of responses, I get overwhelmed, but it just makes me feel so wonderful to hear those type of responses.
I love that grace is working through you, Tarralyn.
Yes.
It's beautiful, beautiful. Well, stay right there. Dr. Yoon-Flannery, come on back on, please. There we go. My double duo, my dynamic duo. So, Tarralyn, do you have any questions for Dr. Yoon-Flannery?
Yes, Dr. Flannery. I heard a lot about you, and when she was speaking, I was like, wow, she's just like my oncologist. She has an internal passion. You can hear that in your voice. I like the fact that she indicated that she take notes and give her patients something to take home with. I was like, wow, she is amazing, because it reminds me so much of my two physicians that I have been walking alongside with me, and that is so. I get choked up hearing her say that, because it means so much as a patient to have a physician that care, not just in the room with you, but outside is still working alongside with you as an advocate to help you through the process. That's amazing, Dr. Flannery.
Thank you. And I have to say, I really enjoy watching your interview just now. I mean, to say that it was profound, I think as moms, as women, as physicians, as patients, with all the roles that we have, it is so hard to prioritize yourself. And as a physician, as a surgeon, I sometimes, I've been told that by others, I don't think that I could ever change myself, but the connection that I have with my own patients, sometimes it might be a little much to the outside, because, I'm so devoted to my patients, like I would be to my family, that when they, don't have great outcomes, or they don't do well, cancer's aggressive and it progresses, it really takes a piece out of you in ways that I don't think I could have ever imagined until I was, where I was. And so, and I have to pick myself up, right? When my patients don't do well, the next day I have to forge on, because I have another patient on my table that I have to just buck up and treat her. And it's definitely, to say that it's a journey in a lot of the ways it is, but I have been told, especially recently, that you cannot treat your patients, you cannot do well for your patients unless you're in a good place for yourself. And so when you said you have to prioritize yourself, you know, all the guilt that I may have felt in the past, trying to maybe get away for a few minutes, it really hit me when you said that, because it wasn't too long ago where I really had to come to a conclusion like that for myself to do that. So thank you.
Thank you. Thank you, Dr. Kayhun-Flannery. And Tarralyn Jones, now I know we have questions, so we have a Taryn Jones with our ACS Healed team. A Taryn Jones and a Tarralyn Jones. How about a double team? I love it.
I really thought that was on purpose. I said, oh my God.
Your mic's off, Taryn.
Good afternoon, everyone. It is so great to be able to fill in and join you guys today. As Pat said, not only do we have questions, we have a lot of questions today for you. So thank you for being so engaging. Before we get started, Pat, though, I did want to give a little shout out to Hugh, who's joining us. Hugh seems to be joining us every week, and he just wanted to let you know that he just got his prostate biopsy back, and he is all good, all the clear. So what another reinforcement of the power of screening, right?
Way to go, Hugh.
So great job, Hugh. So we do have a bunch of questions. I had said I'm going to direct the first question to Tarralyn. This comes from Drew. He had said, did being a part of the Mothers Association, being part of it, how being part of it helped you through your cancer journey?
I joined the Professional Football Players Mothers Association actually the year after my treatment in 2014. But since then, they have been a support system, not only from that point, but for other moms that has been going through a similar, if not the same journey as a support system.
I also have a question. This is actually a question from Kayhun. Kayhun said, it seems that all of you are loyal and passionate supporters of the American Cancer Society. So Pat, this is directed towards you too, it seems. Why should others join the fight against cancer?
I'll let my guests answer first.
Cancer affects everybody. You know, is there one person that we know that hasn't been affected by some type of cancer? You know, that's the unfortunate truth, right? And until if we waited until we ourselves were personally affected directly, then the fight will just be longer, you know? And so the only way that we're going to be able to do it is to do it together. And so that's why I am so appreciative of what American Cancer Society is doing and what all of you guys are doing, because that's what leads to advancements to guide me to treat my patients.
Tarralyn?
And for me, it's the research. I tell everyone to support American Cancer Society and contribute towards the research, because they're making great strides towards the finding of a solution to the cancer.
Tarralyn and Dr. Yoon-Flannery, mine's a little different. I was diagnosed with T-cell lymphoma on my chest. I didn't know anything. I knew nothing about it. I just got it. I checked it, had it checked out, biopsy, and they told me my body had cancer. And so I took it as a calling. I figured, okay, if God's going to diagnose my body, it didn't bother me at all, but if it's going to diagnose my body, then I'm going to use this to help others so that they don't suffer. You might be in pain, physical pain, but psychological suffering, that's a choice. There's an old Buddha saying, pain is inevitable, suffering is optional. So it's part of our mission here at ACS is that you not suffer, and that you follow Tarralyn's guidelines, and you follow the insights from Dr. Yoon-Flannery, and get screened and detected, and find surgeons and physicians who really care about you and want to take you through the process to health and freedom.
So we have another question from Paul. He said, I am a recent cancer survivor. Oh, I get choked up. A cancer diagnosis often impacts the caregivers, although in a very different way. What advice do you give to caregivers who often carry the weight of their loved one's diagnosis?
I think from my perspective, I see a lot of patients with their husbands or significant others, and they obviously, rightfully so, have to take a back seat, right? And so they don't say anything. They listen, let the patients talk. And then they break down when I call them or I see them in the recovery area, usually. And for whatever reason, it is just heartbreaking for me to see a crying husband, who couldn't cry in front of the patients, and it just unleashes on me. And it's a burden that is just so undue for the caregivers. But I always tell them, listen, you're going to unleash, call me later, cry it out now, but you have to pull it together. When she wakes up, you got to be there for her. Okay.
Mhm.
So if you want to call me and cry later, fine, whatever we got to do, but you got to be there for her. And I usually, really try to talk them through that. It's an enormous amount of pressure, but we're there all to help the patients, and the caregivers certainly have their role to play for sure.
Mhm. And in my case, it's true. The caregivers take a huge toll, as a toll on them. They simply don't know what to say. They don't want to show their emotions in front of you, but they take on a lot. They very careful about what they say, their facial expressions. So it's a lot on them.
Do you have more questions, Taryn?
Yeah, I do. So this
Good.
kind of goes back a little bit to what Kay had mentioned earlier. This comes from Gina. Gina said, cancer affects everyone, but it doesn't affect everyone equally. Why is it critical for everyone to play a role in addressing health disparities in breast cancer, from screening through survivorship?
I think it is just so interesting, and I'm just so grateful for all the research that has recently gone in for fighting the health disparities. We have known that particularly for African American women, Tarralyn, you're an African American woman, the African American women are more likely to be diagnosed with triple negative breast cancer. But that's not a widely known fact until you go to some medical conference or somebody like Tarralyn happens to be talking somewhere. And so that's where it really matters. Like the one person who hears about it, then tells their sisters, their neighbors, their grandmas, we need to be aware of this. It's so important. I think education is key, and attention to really figuring out, is there more to it than this, is really key to all of this. I recently attended what we call an implicit bias training, which I found very helpful. Even as a researcher, even as a clinician, I'm of the minority descent. I know I have the name Flannery, but that's my husband's name. And so I've been through it all. And I thought for the longest time, I am not biased. How could I be biased? And I took this training, and it really opened my eyes, as to why there's lack of clinical trial participants, particularly when it comes to minority communities. It not only has to do with perhaps the lack of education for the patients, but also the providers and the physicians themselves. And so I really think it's so important that we're finally paying attention to all of that. And we just need to continue to do what we're doing now.
Tarralyn, do you have anything to add to that?
Dr. Flannery, she did it all in a nutshell.
We also have another question. I think this really is directed to Dr. K, but I think both of you might be able to provide some input for us. How does one keep the passion and compassionate spirit through working through such a devastating illness?
Tarralyn, you go first.
Yes. Like I said, it's the mindset. I initially said I never really bought into it. because I was in a position where I just couldn't. I was a young mom, wife. I stayed on the course with the directives from my physicians, the treatments, and that, thank God the outcome was successful. It's the mindset.
I think for me, I've always, for some reason, even before I became a breast surgeon, just always found myself connecting with patients. I don't look at patients as, 46-year-old with breast cancer diagnosis. I look at them as Tarralyn Jones, with a son in the NFL, or who, had issues. I get to know my patients, and my residents who spend time with me really see that. The connection that you develop with your breast surgeon is just incredible. Patients, when they come to me for follow-ups, the residents were like, why are you talking about their swollen legs or their daughter's lump? It is just really eye-opening what they share with you. And, from my perspective, I think I'm able to really make that connection because I really get to know them and their family members, all of their social issues, all of their problems. And it's just so important as physicians to look beyond just a number or the diagnosis. It's a person. What are they doing with their family? They all have kids, and everything.
Stay there, Dr. Yoon-Flannery. Why do you want to get to know them as a person?
I think it makes me more invested. I mean,
Right.
to me, I tell my patients, I just treated somebody who has 4 children. I have 4 children. I told her, our kids are about the same age. You and I have to look at each other the next 40 years, 50 years together. And you're going to tell me what kind of crazy things your kids are doing, just like I'm telling you what my crazy kids are doing. And to me, it makes me more invested. Not that I force myself to do it. I can't help myself, even if I think I wanted to detach. And sometimes, some days, I feel like I could detach, but I can't. And it's really just because I want my patients to walk away thinking, you know what? Dr. Flannery, she treated me like she was my mother or my sister. I want my patients to feel like I'm treating them just as I would want my mother to be treated.
Right.
And to me, that's just so important.
And Tarralyn, same question, but regarding the Professional Football Players Mothers Association, what is it that you want to share? Why?
It goes back to, I want to share self-care and share your experiences authentically to help others, especially with American Cancer Society, early detection, support American Cancer Society for the research, because the research is going to take us to another level.
Tarralyn Jones, thank you for joining us here today on our ACS Healed Community Gathering. She's the author of Living a Masked Life, Live, Love, and Laugh. I love it. There's that laugh. And Dr. Kayhun Flannery, co-director of the Janet Knowles Breast Cancer Center at MD Anderson Cancer Center at Cooper Hospital, a breast surgeon, and just a wonderful advocate for living life with a smile. And thank you for joining today, Dr. Flannery. I really enjoyed both of you. And to this month, obviously, is Breast Cancer Awareness Month, and you brought so much to the table and shared so much of your own personal story with everyone that was just happiness in motion. Thank you.
And laughing. Thank you so much for having me.
Thank you. I like to end our community gatherings for the HEALED program with just an attitude of gratitude. So Tarralyn, you'll really love this. It's just it's a prayer, but not a petitionary prayer. And you talk about grace that both of you brought to the table today. And Taryn is always full of grace. Thank you for the grace in allowing me to welcome what is happening right now. Right now. Remember, Tarralyn, we were talking about now. Dr. Yoon-Flannery, you deal with your patients and your hobbies right now. Thank you for the grace in helping me to welcome what is happening right now. Thank you all.
Thank you.
Peace.
Thank you.